Dr. Fronstein, in your written testimony, you said that that small employers have been responsible for the decline in the number of employers that are offering health benefits. What has happened to cause that to occur? What steps can we take so that small employers are wanting to offer those health benefits?
Yeah, keep in mind that small employers were never as likely to offer health benefits as large employers, and there's clearly an affordability issue there.
And it's just a complexity part of being a small business, right?
I think the complexity part comes in because a small business, you don't have as many people that you could delegate these responsibilities to. You could certainly hire a broker to help you navigate the health insurance part of it, but that's just one more piece when you're potentially starting a business.
Right.
I think the challenge with small businesses is that we've done surveys, they're dated, right, about 20 years ago, where we asked small businesses that didn't offer coverage why, and whether they thought it had a negative impact on their business. And for the most part, they didn't. So if you can't convince them, and the NFIB has asked a similar question like that recently, if you can't convince these businesses that not offering it has a negative impact, I think it's going to be very tough to convince them to offer it. Even if premiums were more affordable, they're just not focused on it.
I had a whole list of questions. I'm going to kind of go I'm going to wax philosophically here, if that's okay. Mm-hmm. So I'm reflecting on the fact that in America at one point employers created pensions, right? And they managed those pensions, and over time, decades, they became unsustainable. They became a liability. There was a lot of uncertainty with those, and sometimes you would have people that would lose out because their employer might go belly up, and now their pension is gone. And so the result was this institution created a tax incentive for individuals, or created a mechanism so that employers can offer IRAs, can offer 401ks that put the money in the hands of the individual. Let them choose where their investments are going. Let them choose that. Could something like that be done with health insurance, where the federal government is giving the same tax benefits, but encouraging the employer to provide a benefit that the employee then takes control of?
You could do that now under existing rules with ICRAs, individual coverage health reimbursement arrangements. Employers can give workers money on a tax-free basis and let them go buy insurance on their own. It's not a very popular benefit. I think at most, there's different estimates on how many people are in such an arrangement. They're all small, right? Maybe
so it's not. I've not heard of it. It's very underutilized.
Maybe 1 million people are in such an arrangement, but I don't think we know exactly. I've seen numbers of 200,000, maybe 400,000. You add independents, you could double that number. So that's where the 1 million estimate comes from. We've asked large employers about it. Some of them we've asked about it to see if this is something they'd be interested in. Didn't even know about it. I think the NFIB survey asked about it as well, and there was a lack of familiarity there. I don't remember the specific numbers.
Mm-hmm. Being a former state legislator, I saw firsthand how a lot of employers were happy to move to an ERISA plan and to escape all of the state regulations, the health, the mandates on what they have to provide care for. And I can only imagine how difficult that would be to go if you were occupying or had employees in multiple states. Let me ask this: what else can we do, to for example, to ramp up that individual program for small business owners? I know that we've got the association opportunities as well. Is there anything else that you can see? I don't know to what degree small business. You got two kinds of small businesses: those that offer coverage, those that don't. I don't know that those that offer coverage are going to go in that direction, but they're already committed to offering coverage. And while you've seen some erosion, it hasn't been a very large erosion. I think this would be more appealing to employers, small employers that didn't offer coverage, as a way just to give their employees some tax-free benefit. Has Mrs. Schuman, has these associated plans these plans, where you're grouping people based on association, have they experienced any savings?
Well, our member companies are primarily, large multi-state employers that provide comprehensive health care coverage to their employees. So it's just not.
This may be a question Mrs. Wade can
yeah,
answer.
I think.
The gentleman's time has expired.